Strauss, and welcome everyone. I'm going to get started. And this is our Community Opioid Response Project. And just as a reminder for why we're doing this, why we're here, we know that addiction and pain are serious public health issues, and drug overdose, and particularly opioid overdose and abuse, has become one of the leading causes of death from injury in the United States. And in response, our program, the Bridge to Life Community Health Education Program, is dedicated to helping to end the opioid crisis through weekly prevention and awareness classes, through our workshops, our demonstrations, and activities. So thank you for being with us tonight. And so we're going to be talking about NARCAN. Trade name is NARCAN, generic name is Naloxone. And what we will learn about today, we'll have a refresher on what NARCAN is, what it's used for, how it works. We'll look at signs and symptoms of opioid drug overdose, how and when to administer NARCAN nasal spray. We'll talk a little bit about how to get NARCAN. And we'll take some time to discuss opioid misuse risks in the workplace and how you can make a difference. And as always, we want to go over our rules for our session. We want to always remember to be respectful, especially if someone else is speaking. You want to remain on mute unless you're speaking to the group. I encourage you to ask questions. Ask questions. You may not have all the answers, but we're all here to learn, and no question is a dumb question. So feel free to ask questions. And we remember that what is said here stays here. And we also ask that if you've learned something that's been impactful in your life, feel free, share what you learned with others. And so we want to jump right into our session this evening. We want to be respectful of everyone's time and make sure that we have plenty of enough time toward the end to share and discuss what we've learned this evening. And we're going to jump right into our training refresher. This is going to be a video from Jack Latchford, who joined us before and provided the Naloxone training for us. And Jack is the harm reduction outreach worker for the Harford County Health Department. And so we will go to that video, okay? Take notes, and if you have any questions, let's talk about it at the end.
Hi, I'm Jack Latchford. I'm the harm reduction outreach worker with the Harford County Health Department, and today we're going to be talking about responding to an opioid overdose. First thing we're going to do is talk about the steps to responding. You're going to want to be able to identify an overdose, call 911, administer naloxone, do some rescue breathing, and then provide post-care. Identifying an opioid overdose is very important. What you're going to want to look for is loud snoring or gurgling noises. Breathing can be slow, shallow, or not at all. Body can be very limp or very rigid. The skin can be pale gray or clammy. Lips and fingertips can be bluish. No pulse, or the pulse is slow or erratic, or they can be unconscious and unresponsive. The first thing you're going to want to do is rouse and stimulate. What this is going to do is it's going to help you be able to identify whether a person is just overdosing or severely nodded out. If there's no overdose, you don't want to precipitate unnecessary withdrawal by giving them naloxone. What you're going to want to do is shake that person's shoulders, say their name is Jack. Hey, Jack, are you doing okay? If that person does not answer, you're going to want to perform a sternum rub. What a sternum rub is you're going to take your knuckles like this and rub it up and down the center of their chest like so. The sternum is right here. All that's going to do is it's going to be super uncomfortable for the person, and that's going to wake them up if they're just passed out. Next thing you're going to want to do is call 911. Reason being is that the individual may have complications or other health problems. Again, naloxone is only temporary, and they may need to give additional doses of naloxone that you might not have on hand. And also, it might not be an opioid overdose. Some things that can look exactly like an opioid overdose but aren't are cardiac episodes. They could be having an allergic reaction. They could have fallen and hit their head. There's a lot of different things that it could be. There's also the fact that it could be multiple substance overdose, in which case the naloxone is going to work for the opioids, but it's not going to work for anything else. So you're going to want to call 911 as an abundance of precaution. Next thing you're going to want to do is administer naloxone. What you're going to want to do is remove NARCAN nasal spray from the box. The box of NARCAN nasal spray looks like this, and this is what we give out at the health department. As soon as you take it out, you're going to want to peel back the tab with the circle open of the NARCAN nasal spray, like so. Then you're going to want to hold the NARCAN nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle, like so. Next thing you're going to want to do is gently insert the tip of the nozzle into the individual's nostril. You're going to want to tilt the person's head back and provide support under the neck with your hand. Then you're going to want to press the plunger firmly to give the dose of nasal NARCAN spray. After which, you're going to remove the NARCAN nasal spray from the nostril after giving the dose. One thing to note is that these do not need to be primed. So when you're ready to give it, just press it and it should fire right off. After administering naloxone, you're going to want to allow 1 to 3 minutes for the naloxone to work. What I try to do is I look at my watch and I say, hey, it's 9 o'clock right now. That means that at 9:02, I can give an additional dose of naloxone if that person is not breathing. After you give the naloxone, what you're going to want to do is perform rescue breathing so long as the individual is not breathing or is breathing insufficiently. What rescue breathing looks like is you're going to lay a person flat on a flat surface, lay the person on their back. You're going to want to tilt their chin open to open the airway. Then you're going to want to remove any airway blockages, and you're going to want to pinch the nose closed. At the health department, we use masks. So if you're using a mask, you're going to put the mask in the person's mouth. You're going to reach under and clamp their nose closed. And then you're going to want to give 2 deep breaths of 1 second each. And then you're going to want to give an additional breath every 5 seconds. After administering naloxone, you're going to want to continue rescue breathing if the individual is not breathing or is breathing insufficiently. If breathing is not restored after 2 to 3 minutes, you can give an additional dose of naloxone. And then you're going to want to stay with the person and provide care until medical help arrives. Again, staying with the person until medical help arrives after an overdose. It is also important to keep the person calm and encourage the individual not to take more opioids. If an overdose reoccurs, administer another dose of naloxone. Support an individual in accessing treatment services. Side effects of naloxone. After receiving naloxone, a person may feel physically ill or vomit. They might experience withdrawal symptoms, which are unpleasant but not life-threatening, and they can become agitated, confused, or upset. What I like to say is that if you give a person naloxone and you see them start to wake up, I would take a few steps back and just give them their space. Reason being is that, again, they can become agitated, confused, or upset in this situation. They're going to be waking up to people standing over them. They're not going to know what's happened. They were just blacked out. So again, give them a little bit of space. Good Samaritan laws. Last thing I want to talk to you guys about is the Good Samaritan laws in the state of Maryland. The Code of Maryland Criminal Procedure Article 1-210 states that a person who seeks, provides, or assists with medical assistance for another person experiencing an alcohol or drug-related medical emergency cannot be arrested, charged, or prosecuted for possession of a controlled or dangerous substance, possession or use of drug paraphernalia, or providing alcohol to minors. And again, calling 911 will not affect your parole or probation status. That being said, if you have distribution amounts of drugs, this will not protect you for that. And if you have warrants out for your arrest, this again will not protect you for that as well. The other side of the Good Samaritan law states that the Code of Maryland Health General 13-3110 says an individual who administers naloxone to an individual believed to be experiencing an overdose shall have immunity from liability under 6-603 and 5-629 of the Court's Judicial Proceedings article, which basically states that you cannot be held liable for a good faith attempt to help someone. Last thing to note, if you do administer naloxone, please call the Poison Center at 1-800-222-1222 within 1 to 2 hours of administering naloxone. Another thing you can do is you can call me at the health department and I can help you out with this process. If you have any questions, please feel free to email me, or you can call me at my number listed right here. Again, I'm Jack Latchford with the Harford County Health Department. Thank you very much.
Very good. We appreciate that presentation from Jack. I'm just trying to get back to my PowerPoint. Okay. If you have any questions, feel free to unmute yourself or place your question in the chat. Again, that was a refresher on how to administer, how to respond to an opioid overdose. One thing that he didn't mention, but we want to make sure that everyone knows that if you live in the Harford County area, you can go to any ShopRite supermarket, go to the pharmacy there, and simply ask for naloxone. They have an arrangement with the Harford County Health Department where the health department has already paid for naloxone to be distributed. And so ShopRite will provide that to you free of charge, no questions asked, no forms to fill out. You just ask for it and they will give it to you. Okay, so they made it very easy. Another thing we want to be mindful of is how to store naloxone. If you have NARCAN, if you have the NARCAN spray, just be mindful of the expiration date on it. There are two different generations of NARCAN spray. You'll see the two different types here, where one has the white plunger, the other has a red plunger. The only difference is that the red plunger lasts a little longer. It expires in 36 months instead of 24 months. And there is some slight differences in terms of the temperature that it needs to be stored at. But they both have the same level of efficacy if you administer it. And so just want to be mindful of that. And you want to remember, if someone is taking prescription opioids at home, if you have prescription medication, say for an injury, I don't know, a dental surgery, anything that someone has prescription medications for, if it's an opioid, they should have NARCAN also available at home in case of emergency. So please keep that in mind as well. So I have two questions here that's just kind of like a brief survey. And if you would just put your answer in the chat. On a scale of 0 to 10, with 10 being the most difficult, how difficult do you think it is to administer NARCAN? Would you put your answer in the chat, please? How difficult do you think it is to administer NARCAN? Let's see what we have here. We've got some 1, 0, 5, another 1. We have a 10. Okay. All right. Very interesting. So it appears that most of us think that there's not a high degree of difficulty, but those that had either a 5 or a 10, would you share what the difficulty might be? What do you think that difficulty might be in administering NARCAN? You can take yourself off mute and we can just talk about it. What do you think the difficulty is?
I think the difficulty is just determining whether the person needs, if they've actually had an overdose or for some other thing, and there would be some apprehension maybe on my part to begin administering that.
Mm-hmm, mm-hmm. Okay, okay, very good. Very good. Is there another response?
How much to give?
How much to give? Is that what you said, John?
Yeah.
Okay. So two things. So with NARCAN, once you press the plunger, that's one full administration. That's one full dose. Okay. So there's no like half dose or anything like that. Once you press the plunger, the entire dose goes. That's a full 4 milligrams. Okay, so you don't have to try to measure out or figure out how much to give. All right. And in answer to your question, Charles, even if someone is not having an opioid overdose, if you administer NARCAN, it will not negatively affect them unless they're allergic to Narcan, which would, you know, if they had an allergic reaction or some type of allergic response to Narcan in the past, of course, we would have no history of that. We wouldn't know that. But they would be given Narcan, whether it's an opioid overdose or not. If they were passed out, if somebody was going to administer Narcan, they would go ahead and do that. And the risk is just not knowing whether they actually have an allergy to it. But outside of that, there's no other untoward effects that have been known or written up in the clinical journals, and it is considered a safe medication to administer.
Very good, thank you.
Sure. Were there any other questions regarding the level of difficulty? Any questions?
Question.
Yes, Ina.
What time of the day do you have to administer?
Repeat it for me, Ina.
What time of the day do you have to administer? In the morning, afternoon, or evening?
Well, no, you would only administer it if you saw someone who appears to be having an opioid overdose. So it's you don't give it based on the time of day, you give it in response to someone having an overdose situation. So it's almost like as in an emergency type of response. So it doesn't matter what time of day it is, it really just matters. The issue is whether you need to respond to what appears to be an opioid overdose. Does that help?
Yes.
Okay. Very good. All right. So that leads us to our next question. If you're present when someone is experiencing a suspected overdose, would you want to have naloxone available to you? So whether it's with you or if it's, say, on your job, would you want your job to have it available? Put your answer in the Zoom chat and let's see. If you're around, you're present when someone is experiencing an overdose or suspected overdose, would you want to have naloxone available? Shadana, I'm going to ask if you would do us a favor and just share some of the feedback out of the chat. And this will kind of help me to be able to continue to screen share without too much interruption.
Sure. I think everyone is saying yes, definitely, sure.
Oh, great.
Definitely positive responses.
Very good. Very good. Certainly would be helpful to at least have it available. And one of the goals of our training is to help to encourage us all to have some level of comfort. If you're that person that's there when something happens, and it might be someone who has a known issue with opioids, and there's a suspicion that they've overdosed, they might be in a bathroom or in a room, passed out, and if naloxone were available, if you're the only person that knows how to give it, we want to make sure that you have a level of comfort in doing that, okay, or a level of confidence in doing that. And so that's one of the reasons why we wanted to have this training, okay. One of the things that we're going to look at also this evening that I discovered as I was preparing today was that there are a lot of workplace risks that we really may not have thought about, but the US Bureau of Labor Statistics data, they've identified workplace risks for opioid misuse in several industries. And so we should have an awareness and a sensitivity to individuals who are in jobs that have these higher risks for using opioids. So from the list here, and you can put it in the chat, which occupations or industries below do you think have the highest risk for opioid misuse? Which ones do you think have the highest risk? We have the restaurant industry, construction industry, healthcare, the warehouse industry, education or schools, retail industry. Which ones do you think have the highest risk for individuals in that industry to use opioids?
We have restaurants and warehouses. so far.
Okay,
Construction,
okay. Very good.
construction and warehouses.
Mhm.
Another one for construction.
Very good. I think you all are on the right track. You may be surprised to know that construction is the #1 highest risk industry, but all 6 of these industries have been identified as high risk for opioid misuse, with construction being the highest. A lot of it just related to stress, the physicality of the industry, of the occupation itself. And so we're going to take a look at some information and some videos to get a little more information on this. First, we'll take a look at this video about opioids in the workplace. This is particularly in the construction industry. So take a look.
We first started to notice serious issue with opioids amongst our membership, probably going back into 2010, 2011. We were operating a national drug testing program in conjunction with our contractors and our clients. And we started to see our positive drug tests where traditionally you'd think marijuana or cocaine use would be the preponderance of them. But all of a sudden we started to see we had more people testing positive for opioid use than we did for the other drugs. At the time, we didn't have a lot to make of it. We didn't really understand what was going on.
The first opiate was from a poppy plant and produced what was called opium. And from opium, many new products were made, morphine and things used in medicine. Those were called opiates that were derived from the poppy plant. From 3,000 years ago, we knew they helped pain. But even 3,000 years ago, they also knew that people would feel good on them and that that was a problem.
Several years ago, we embarked on a study to look at opioid-related overdose deaths by industry and occupation. We have community partners around the state, and several of them were looking at their death certificates and they were saying, we're seeing lots of workers in the trades, mostly construction workers, but other blue-collar trades. So we said in Occupation Health, we look at the death certificates all the time by industry and occupation. So we can look at this for you. Let's look at it statewide. So we undertook this study to look at opioid-related overdose deaths by industry and occupation. We decided to go beyond just counting the deaths and the rates, but also begin to explore what could potentially be some of the contributing factors that might account for these differences.
So when we saw this high rate of opioid-related overdose deaths, one of the first things we thought about was, well, what are construction workers? What do they experience at work that's different or worse than other workers? And the first thing our minds went to with the Occupational Health Surveillance Program is occupational injuries. So construction workers have much higher rates of occupational injuries at work, but also fatal injuries at work compared to other workers. We also know that construction is a precarious industry in a lot of ways. Workers don't always have a guarantee of work, especially if they're non-union. So we thought that that precarity might contribute to the need to work in pain, for instance. Working in pain might contribute to using opioids in order to not be in pain while you're working, and then also might lead to misuse down the road.
It's a hard business that we work in. It's injury. There's no time off. There's no sick time. There's no paid vacation, so to speak. And, you know, they work through their injuries.
I think construction industry as a whole has a much higher risk because of the work we do. The wear and tear on the body, the physical pain that most of our members go through, and not knowing how to deal with it.
Before becoming a union iron worker, I worked as a laborer. What got me into the drugs were from doing all this manual labor. I would get hurt or go through pain, put in a hard day's work, and I needed something stronger. something to numb not only my physical pain, but the one mentally that was going on up here. I hit a very low bottom due to these drugs, and I was just stuck in this vicious cycle with no solution.
Our jurisdiction is New York City and Long Island. I started following overdose rates in Long Island around 2006 and watched it jump from 40 a year to 68 to 120.
There's one study that was done in Massachusetts of commercial construction workers where 70% reported working in pain. And in that same study, they reported high prevalence of mental health issues. And one of the hypotheses that those authors had was that construction workers don't necessarily seek the help they need when they confront psychiatric problems or stress.
I think construction workers don't seek help as often as they should. And I think this is true for any industry, it's fear. We're all full of fear. And we all fear what other people think of us, or we fear success, we fear change, we fear failure. But I think fear drives a lot of people to not seek help. And in particular in construction, I think that you're around a bunch of manly men, tough guys, you know, and you're building cities, you know, to come forward and say, hey, I'm struggling with such and such a drug or an opiate or alcohol. You always think the person next to you is going to think less of you, and, you know, you're not going to fit in.
The question of how we approach addictions today has shifted. You will hear people say it's a medical illness, and so that's called the medical model. That's what we call, it's purely physiologic, meaning it has to do with how the body is working and reacting. In psychiatry, we go a step further and we look at what's called the biopsychosocial dimension of an addiction. What that means is bio would be genetic. Psychosocial has to do with the psycho is your temperament. Some people have hot or cold temperaments, if you will. And then the last one, which is probably the most important part for everybody to know about, is the social setting. Did you grow up in an abused child relationship? Did you grow up in a neighborhood where drugs were prevalent? And of course, for construction workers, the tough thing is high demand, high stress, a lot of bodily injuries, and the availability of opioids. And so that's the social setting.
The nature of the businesses, we get banged up, we're in pain. There's a lot of drugs on the jobs. A lot of guys are using. It's easily accessible. A lot of the guys have the mentality, we work hard, we should play hard. And the overdoses started becoming more rampant with the fentanyl, because the heroin's kind of disappeared, and that's primarily the drug of choice now.
Somebody working under the influence of opioids in the construction business not only puts their life at risk, but puts the lives of their coworkers at risk, and potentially the public as well.
There's not a day that goes by, you don't turn the news on or open the newspaper, and it's right there. So it's every single day we see it. We're trying on the defensive end and trying to just figure it out, how to handle, get that person, get them healthy, and get them back to work and being safe.
We have one other that we're going to share with you as well, and then we'll have our discussion.
Opioid misuse and overdose are serious health concerns in the United States. Overdose deaths involving opioids doubled from 2010 to 2016, with more than 42,000 deaths in 2016. By 2018, opioids were involved in more than 46,800 deaths. The effects of opioid overdose and misuse are not isolated to home environments. Overdose deaths at work from non-medical use of drugs or alcohol increased on average 38% annually from 2013 to 2016. 217 workplace overdose deaths were reported, accounting for 4.2% of deaths at work that year. When injuries happen in the workplace, opioids may be prescribed. Opioid use is associated with risks, including opioid use disorder and overdose, with the consequences affecting both an individual's working life as well as their home life. Workplace risk factors that might lead to opioids being prescribed include unsafe conditions that lead to injury, such as slips, trips, and falls, or heavy workloads. Other factors such as job insecurity, job loss, and demanding low-control jobs may also be linked with prescription opioid use. There are drugs such as naloxone that may temporarily stop the life-threatening effects of an opioid overdose. More than one dose of naloxone may be needed to reverse some overdoses. Naloxone alone may be inadequate if someone has taken large quantities of opioids, very potent opioids, or long-acting opioids. For this reason, call 911 immediately for every overdose situation. Some business owners have incorporated a naloxone use program in their workplace. Have you considered having a workplace naloxone use program? NIOSH, a federal agency that studies worker safety and health, has developed solutions to help employers face the issue of opioid overdose in the workplace. Information in our fact sheet using naloxone to reverse opioid overdose in the workplace will help you decide if a workplace program for administering naloxone is right for your situation.
Conduct a risk assessment. Decide whether workers, visiting clients, customers, or patients are at risk of an overdose. Recent studies show higher opioid overdose death rates among workers in industries and occupations with high rates of work-related injuries and illnesses. The need to return to work soon after an injury or to remain at work in spite of an injury may contribute to high rates of opioid-related overdose death. Workplaces that serve the public are also at risk. Places like libraries, restaurants, and parks may have visitors who overdose while on site.
Is your business or workplace at risk? Does your state allow workplaces to administer naloxone? What liability and legal considerations should be addressed? Do you have the staff willing to be trained to provide naloxone? Is there evidence of opioid drug use on site? Or has your workplace experienced an opioid overdose? How quickly can emergency response personnel access your workplace to provide assistance? Does your workplace offer other first aid or emergency response interventions? Are the risks for opioid overdose greater in your area or industry? Does your workplace have frequent visitors, clients, patients, or other members of the public that may be at increased risk of opioid overdose? If any of these issues are important to you, then consider exploring a naloxone use program for your workplace. Establishing a naloxone administration program. Conduct a risk assessment. Consider liability and other legal issues related to such a program. Set up formal procedures for documenting incidents and managing records. Assign staff roles and responsibilities. Train staff to lower risks. Plan for the purchase and storage of naloxone. Store personal protective equipment for naloxone use close by to protect against chemical or biological exposures, including opioid residues, blood, or other bodily fluids. Plan for follow-up care. Reevaluate your program periodically.
If you decide the program might be right for your workplace, the fact sheet can help guide you through the decision-making process. Provide the information you need for a safer and healthier workplace, and get you started with establishing a program designed to meet your business or workplace needs. Please visit our website and download a copy of Using Naloxone to Reverse Opioid Overdose in the Workplace to find out more detailed information and links to other resources.
Ms. Dina, we have a question in the chat. What would be classified as an opioid?
What would be classified as an opioid?
Mm-hmm.
So we know that opioids are derived from opium, all right? And there are several different drugs. I'm sorry, there's something flying around here. Several different drugs, such as, OxyContin. I mean, we could start to call up certain names. Percocet, anything that has an opium base or opium element to the product. But the issue also now is that opioids are being laced with other drugs that are even more powerful, such as fentanyl. So even though our focus here, we talk a lot about opioids, but other drugs such as fentanyl and other drugs that are being mixed with opioids are even more dangerous. So I hope that answers the question.
Does that answer your question, John? All right, so we hope it does.
All right. So I wanted to share those videos with you because there's some things that we heard about risks on the job. What are some of the reasons that we heard that might lead to someone either using opioids, or if they're using opioids, they may be at risk for opioid overdose. Some of the things that we heard were, we heard about high stress at work, high risk for injuries, the fear of failure, fear of people thinking less of you, the issue around ego or not feeling as if you can talk about it, and then the availability of drugs on the job, that social setting, and others using opioids. Those are all factors that really kind of, that can push somebody into the direction of using opioids. And they need help. We need to make sure that, that we're able to help point them in the right direction for professional help. Just encouraging them to seek professional help if we're aware of a situation, but also be prepared to help in case there is an actual overdose situation at the workplace. So, it's good to be able to get ahead of how you might be able to respond. And I have a personal story that I wanted to share with you. A number of years ago, I was working in a hospital in New Jersey. And I worked on the orthopedics floor. And if there's anybody in our session that's worked in the hospital setting, especially in orthopedics, you know that there's a lot of equipment. It's a lot of lifting, a lot of heavy lifting, and a lot of back injuries. And there was a nurse that was working with me on my shift. And it took us a while to figure it out, but we noticed that whenever she was working, that the narcotics count of on our floor, in our unit, when we would have to start at the beginning of our shift, and at the end of the shift, we have to count how many narcotics are in the narcotics bin. The count was always off when this nurse was working. And we would, we'd write it up as, well, this is just something that we've identified and submitted. What we didn't know was that the hospital pharmacy was watching this trend and that they had reported it to the police. And that the police had been watching her for about almost a year with having these counts always off only during her shift. And I showed up for work one day, walked in, the cops walked in right at about the same time, the police walked in. And as she walked onto the floor that morning, they arrested her. And what we came to find out was that she and her boyfriend were taking these drugs. She was taking OxyContin and Percocet, they were taking drugs. And, to find out and just know that she was taking it because of the level of stress that she was under. She had an injury that she didn't want to talk about. And just realizing that, she really needed help. And she didn't seek help. What she reached out was for the drugs. And I'm grateful for the fact that it wasn't an overdose situation that occurred, but there were consequences for that type of behavior. It happens. It happens on several different job type of situations. And so we want to be able to talk about that a little bit. And just know that you may be the catalyst. You may be the one that's able to start that conversation in your workplace about whether you should have naloxone available at your job. And we hope that you have enough information to be able to help to develop those tools, to look at the assessment, and you just evaluate whether you should have it, where it should be stored, who should be trained. And you've been exposed to how it should be administered. And so, in terms of the level of difficulty that there is around administering naloxone, you can share this information with your employer or coworkers to help them understand that this is possible, that it can be made available, and work through making sure that you have that available, because you never know what might happen, and you may be the one that makes the difference in someone's life. Were there any questions in the chat before I go on to Dana?
Yes, we do have one. Is naloxone safe for children who accessed opiates in their home from an adult? If so, what is the dosage?
Oh, that's a great question. I would have to do some research on that, because everything that I've seen has been related to teenagers, teenagers to adults. And when you say children, I'm not sure what age range we're talking about, but I would say maybe under the age of 12. I have not seen any literature. I haven't read any literature about it, but I'm happy to look that up and provide that information. Okay, so children. And that's a great question, because a child can get a hold of opioids accidentally in the home, and you would want to be able to respond to that as well. Okay. So if you live in Harford County, or even if you don't live in Harford County, if you're passing through Harford County, if you see a ShopRite, go to ShopRite, ask for naloxone, they will give it to you. Okay. I have a box here. This is a 2-dose pack. So there are two, there's enough in here for 2 administrations. So back to John's question in terms of how much to give. If you administer 1 nasal spray container, that will be empty, you're done. If you need to give another dose, you need to get the second dose, open the container and use the second dose of another spray, nasal spray that is full that you can administer. So you get a box, it will have 2 administrations of NARCAN in it. Okay. All right.
Good evening. Can you hear me?
Yes, Lionel. Good evening.
Good evening. So I have another question. I saw in the video that they mentioned that 1 dose may not be enough, depending on I guess how much opiates was taken. And you should seek medical help. As a non-medical professional, as a regular person, should we ever think there's a situation where we'll need to do a double dose of NARCAN?
Mm-hmm. Good question. Absolutely. And that's why they provide the 2-pack, because you may be in a situation where that first dose does not arouse the person. It may not bring them out. It may not start to reverse the symptoms. And so you may need to use the second dose. And so that's fine. So giving those 2 doses would be considered, a sufficient response. And while those 2 doses are loading in the individual system, you would have called 911, sought additional help, and hopefully by then, by the time they arrive, they can take charge of the situation. But giving 2 doses would be the optimal for what they would be looking for in terms of an immediate response by a layperson. Does that answer your question, Lionel?
Yes, thank you.
Sure. Any other questions? So how can we make a difference with what we've seen? First of all, if you're a believer, we know that first thing we can do is pray. Okay, so we always want to make sure that that's number one. But the other actionable things that we can do is have NARCAN available. You know, you may be the one that saves a life. If you may have it either with you, in your car, in your purse, in your home, or even if it's available at the job. If it's available, you have the tools and have some exposure, some knowledge about how to use it, don't hesitate if you find yourself in a situation where that's necessary. Also, you can make a difference by just being a safe person to talk to. And a lot of people, as we saw with the video with the construction workers, where they lean toward using opioids because they don't feel that they're able to talk to people about what's going on. Encourage individuals to seek professional help to deal with stressors and avoid enabling the situation. And what I mean by that is if there's someone who's going through a stressful or difficult situation and a lot of pain, just having a hard time, just dealing with what's going on with life, their job, there's some things if we tend to say to them, or a certain way that we react, that we tend to enable that. For instance, you know, if someone's talking about how difficult, you know, their job is, and you know they're getting hurt all the time, if our response is saying, well, you know, yeah, well, that must really be hard for you, you know, I don't know how you do it, and just not really helping them to look towards solutions to help them manage it better. But if we continue to reinforce or help them, you know, kind of feel, just show that we feel sorry, but not really help them to seek the help that they need, we tend to enable. And so we need to be careful about doing that. If we know that there's an issue, we need to be able to help point them into the direction where they can get some real help. And lastly, where we saw in the last video, think about starting a conversation at your job about having a naloxone use program. There's information that's out there that's available on how to get that started. And you know, I think there's space for having that type of conversation in schools, in the restaurant areas, retail, hospitals. You know, there's so many different places, not necessarily hospitals, but in the healthcare arena, physician offices, clinics. Have those discussions about whether it's available or if it's something that you can have there. And just to wrap up, and just in summary about what we learned this evening, we learned about what NARCAN is, what it's used for, how it works. We learned about some signs and symptoms in the video with Jack about opioid drug overdose. We learned about when and how to administer NARCAN nasal spray, what to do after you give NARCAN nasal spray, give the person some room, back up a little bit, make sure they're in a recovery position on their side. We learned about how opioids are prevalent among certain types of jobs. And we also learned a little bit about how we can make a difference. And I hope that that has been helpful in giving you something to just think about how you can make a difference. Are there any other questions or comments?